fall down. Mama, I'm fine, don't worry. Go back out to sea, sail home, sweet home, where the ships must go to get all cleaned up and put away.
All right. Hello, everybody. Welcome. Happy Friday.
The camera's over there.
Camera's over there.
Hello.
And we're live. Are we live?
We're
Teresa?
live. I think.
Let's
We'll
hope
find
so.
out.
All right. So a little bit different, everybody. As you could tell, we're doing Stump the Advocate today.
It's something we haven't done in a very long time. It was probably like 6 months ago last time we did Stump the Advocate or more.
It's been longer than that, right?
Probably. What else we haven't had in a long time? We've not had Caleb here present in the office with us.
That's right.
It's good to have you back.
I almost forgot what you looked like.
I know, right?
No, it's great. I'm glad I get to be here today. This is going to be a fun one, everybody. And so like always, let us know if you can hear us okay, see us okay. There's always technical difficulties. But Stump the Advocate, if you weren't a part of the last one or the last couple that we've done, this is where we as a team will be asked a question that we have to answer a yes or a no to. And we're going to be keeping score as to how many questions we get right or wrong.
That's
so,
right.
And like always, please drop a comment. Let us know how you're doing. If you have a question or if you just want to shout out your county, let us know what you're going through. If you are currently in the process of getting something like IHSS or regional center, you have somebody in your life with special needs, you just need some direction, let us know. We'd love to hear from you. But we also have a very special guest joining us for the first time, Ms. Bailey. We have Ms. Bailey, who is one of our newer advocates here. She's still in training, but it's going to be awesome to have her here and test her knowledge today. And behind the camera, you can't see her, is Myra Galt, the boss herself.
Oh, okay.
Okay, well, they can still hear you.
She's going to
so.
choose to stay behind the camera for now.
All right, so we don't have any comments just yet. We are a little early. Do we have any live viewers, Teresa?
6.
Okay.
6? Oh, cool. Well, welcome, everybody. Welcome who are here early.
We did start a little bit early because we figured we need time to introduce ourselves, explain what's going on before we get into the game. We want to let everyone give it time. Now, Bailey, since this is your first time here on the stream, how long have you been with Galt Advocacy? It's not been very long so far, right?
Since September.
September. Okay, so a few months, 3-4 months ish.
Yep.
And how long of that time have you been training for IHSS?
Probably about the last few weeks, months.
Okay,
maybe.
so you are.
I originally was going to be
the
doing
IHSS
special
world.
education, but now I'm doing IHSS.
Yeah. So, understandably, me and Caleb have been here many years. We've done IHSS basically the entire time, and so we have a bit of an advantage. But this is sort of an opportunity. We kind of want to see what your perspective might be as someone who hasn't been bogged down in just the world of IHSS and assessments and social workers and just dealing with them for so many years. You might have a bit of a different perspective from us.
Absolutely.
Yeah, and we do want to hear from you as well. So when there's a question asked, we're going to test your knowledge as well. So answer yes, answer no, give us your best guess. I think we have a mixture today of some relatively straightforward, easy questions, but maybe some more difficult, challenging ones. Maybe some fun ones, Teresa, or are they all fun?
I think they're all fun.
I believe you.
This whole thing is fun.
All right.
All right, are we ready to get started?
We are. So I'm ready.
Grab your
Bailey, are you ready?
paddles.
Yeah, let's do it.
All
Paddle
right.
time.
All right, paddles up.
All right, Teresa, give us the first question.
Drum roll.
Scores. All right, here it is. Putting it up on the screen now. Question. IHSS providers can work a maximum of 66 hours per week. This includes all paid services and any unpaid travel time. Ooh.
IHSS providers can work a maximum of 60 hours per week. This includes all paid services and any unpaid travel time. I think I understand the question.
So like all 7 days.
This is, that's just the maximum. I don't know what that is per day,
Okay,
but
enough.
Because I'm thinking of like regular time, overtime, all that kind of stuff. Because like what you were talking about earlier. today.
Yeah, so it says includes all paid services and any unpaid travel time. Are we ready? Are we giving our answers at the same time?
Yes, we're gonna
Okay.
do it on 3. All right.
Okay, 1, 2, 3.
Okay. Did we all say yes?
I think we all said yes.
Okay. Now this is for me, and I'll just ooh yeah. For me, this is a yes with an exception because there is literally an exception,
Mhm.
and that is the exemption. The exemption 2, where if there's special circumstances, you have multiple providers and they can't find, or you have multiple recipients and they can't find any other provider, then you can get up to 90 hours a week. But that's relatively rare. For most providers, it's 66.
There's also the 70 hours and 45 minutes per week number too that gets forgotten about.
Mhm.
Right. And that's a little bit, that is specifically because your recipients gain 283 and because some weeks are longer than others. Sometimes you have to work more.
Right. I think the last time we talked about this, the number we settled on was 66 per week as the maximum you can get in general, right? Without the exemption
Mhm.
or the reason for the 70-45. But
Well, and basically the
The
thing
answer is
is,
yes.
if you work 66 a week, every week, you hit your maximum. If
Right.
you work 70 in a week, one of the other weeks you have to work less than 66,
Yeah.
good point.
and it still only adds up. Anything else?
Cool.
I
Dara?
remember just seeing it when I was doing my training. I remember seeing that number and like that's
All
got to be in
right.
something important.
Give
that
us
you
all
need
a
to
I
point.
know.
sure hope we didn't all get this wrong. Teresa, show us the answer. Okay. Yeah. All right. We were pretty sure about that one, but good to know that we
Cue
all
the
got that one
cheers.
right. Let me. Okay. This is a little bit.
Now, did we have anybody in the comments guess? I don't think I saw any come through.
I don't think anyone did.
All
But if
right.
you knew the answer, just know in your head
Mhm.
that you got a point for that one. All right.
Yeah.
All right. Okay. Well, that was a pretty easy one. I think we're all pretty confident in the rest of these. This is just going to be an absolute cakewalk, won't it? All right, Teresa, give us the next question.
Ready.
This one's a little trickier.
A little bit trickier. All right, if you say so.
I changed my mind. I'm nervous.
All right, Caleb, you read this one.
Hospital discharge plans or individual program plans can take the place of the regular IHSS healthcare certification form.
Okay. I have my answer,
I have mine as well.
but you?
I would say no.
Well,
But I don't know.
Don't tell us your answer yet. Don't tell us
Are
your
you
answer
not-
yet.
you- Oh, I'm going to change my answer now.
All right, are we ready? 3,
I'm ready.
2. Wait, should we ask you guys in the comments?
Yeah, ask them in the comments.
All right, let us know your yes or no answer. We're going to answer anyway just because we got a lot of questions to go through. 3, 2, 1.
Everybody always knows mine.
Yeah, everyone knows yours. A little bit of a spoiler. All right.
I don't know the logistics, but it just doesn't sound right.
So I'll jump into this one,
Yeah.
Dakota. So, I mean, the question is, can the IPP from Regional Center, can the IPP or the hospital discharge plans take the place of the healthcare certification form? The answer is no, if you are needing the healthcare certification form, right? Because the healthcare cert, the SOC 873, is
Mhm.
something you have to have the very first time you apply, or I'm sorry, during the application process for IHSS. So that document can't be replaced because it's mandatory. It's a necessary form in order for the application with IHSS to be processed. So very simple. That would be a no.
So, wrong one. Oops. So my answer is still no. However, that form can be replaced.
Oh,
The healthcare certification form is a mandatory form and you have to get it. However, there is a part in the regulation that says you can get a form in place of the healthcare certification form, the SOC 873, but it has to say the exact things that the healthcare certification form says. It has to say you have a disability. It has to say it will last 12 months. It has to say that you require assistance in categories.
Very
It basically, the 4 questions on that form, whatever you get to replace the form has to answer all 4 of those questions anyway.
gotcha. Which an
And
IPP would not.
discharge plan, IPP would not.
Yeah.
So I'm pretty sure the answer to this is no. Teresa, did we get it right?
Or wrong? The answer is true.
Answer is true.
What?
What?
There's no true or false here.
We were stumped.
Was there an explanation on that one, or did it just say true?
Here's the explanation.
Okay, she's gonna post the explanation. The state allows these as substitutes if they. Oh, okay. Okay, well, I
to
think I got at
relevant
least half a
information.
point on that. one.
That's a half point.
Because I knew that there were
I think-
substitutes.
Those are the two documents that are listed in the list.
Is it really?
Yep.
Okay, I did not know that. I did not know those ones were
Good
listed.
luck getting a social worker to
'Cause
agree to that.
I feel like most of the time, I mean, we've seen a lot of IPPs in our time. Most of the time, they wouldn't have that information. But if somehow they did have that information, I guess it would count in as a substitute.
Yeah.
So you said I could get a half point for that one?
Yeah.
I'd say.
You think so? All right.
We're not fully.
I feel like we all got
You-
that one right in a sense.
Mhm.
Better take off your hat.
Do you now?
Again, since Myra is here, the question was, let's go back to the question real
Oh,
quick.
yeah,
right?
let's see what
So we got
Myra
Myra
thinks of
here,
this one.
right? The question is, can hospital discharge plans or IPPs take the place of a healthcare certification form?
SOC 873.
No.
Okay, that's what we all said.
We all said it.
Because
all
good
said
luck
that.
applying to IHSS without the healthcare cert form, right?
Right.
Apparently, there is a regulation that says otherwise. As long as those documents include the questions that the healthcare cert form has, then technically it can replace it.
If those documents answer the questions that the healthcare certification normally would, they can replace it.
So I guess Dakota does get half a point. Technically, I guess we're wrong.
But the thing you
If
have
we're
to
speaking
understand is, I worked with the judges, and they would throw that out in a second, and they'd say, I want an, and the judge would say, well, what's the big issue? Why can't you go get an SOC 873? What's the big issue?
Yeah.
Well, and
So-
that's a difference of where what the law says and how it's actually
So spirit of the
works
law
in-
versus letter
in-
of the law.
Letter-
in real
Right,
life.
So these questions are based on letter of the law.
We're going to talk
All
about
right. Half a point to Dakota. We'll move
I
on
just
now.
didn't know either of those forms could ever have that information on it.
Those are specifically mentioned in the.
All right.
I feel some collusion going on here.
You know, it's just a coincidence that I'm the one controlling the scores. All right, Teresa, why don't you give us our third question? I really don't know how many questions we're going to get through, but we're going pretty fast so far.
Okay, very good.
All right, third one. Bailey, you want to read this one?
Social workers must write down the exact reason they choose a certain functional index rank for each service in the case file.
Hmm.
Ooh. Okay.
It's
Okay.
taking you guys so long.
Okay, yeah.
We have to do it.
Some of these
all-
are trick questions.
Yeah,
All right.
they are.
Some of them are trick questions.
But they have to let people in the comments answer.
Yeah. I don't think we've had anybody answer just yet, right?
Yeah.
No, people are scared to answer, I think.
All right. How many people are ignoring us right now?
Yeah, how many people are... We see you. Actually, we don't see you.
We
Teresa
can't,
sees
yeah.
you.
So give us a yes or no in the comments because we're about to answer in a few seconds here.
I've got my answer.
I think I got mine as well.
You ready? Okay, well then we're going to go for it and you guys listen to what you think, all right?
Hold on. Let's read one more time. Social workers must write down the exact reason they chose a certain functional index rank for each service in the case file. Okay, are we ready?
All right, 3, 2, 1, go. Well, we've all been in agreement on these questions so
All right.
far.
All right.
But I've been close to flipping because at first I thought they meant the notice of action,
Mhm.
and I don't believe they have to write the reason for every service in the notice of action.
Have you ever seen that?
No, because they usually only will write the reason for protected supervision.
Yeah.
But in the case file, I'm pretty sure they're supposed to write a reason, have it in the assessment notes, right?
Yes,
Yeah.
the case narrative. So usually the case narrative will
Mhm.
assign the rank and briefly explain why. So,
Yeah.
Okay, great. Rebecca did answer. Rebecca, let's highlight it.
Said yes, but they do not always do so. Now that's very true.
That's
Yeah.
probably very true. Yes.
Absolutely. Why did you say yes? Did you just think this sounded
Um,
right?
You know, listening to the assessments that I've been shadowing on,
Mhm.
that's one thing that's always complained about. They just said yes or no. They didn't even give me a reason why. And that's going to be something that they're going to go back and look at, especially if it goes to trial and you say, well, why did you put that rank? Oh, well, because of this reason. But why didn't you write it down? There's no evidence that way for the county that way. So
Mhm.
it actually could be in favor of the client at that point too.
Mm-hmm. And Teresa has given us the answer. The answer, like we all said, is true.
Mhm.
But I think Rebecca's absolutely right that they don't
No.
they don't always do a good job of
Yeah.
actually writing it down. All right, we all get a point for that.
All right.
Ready for your next question?
Give me a second. I mean, actually, yes, I think we're ready. All right. Here it comes. Question. Aid paid pending always continues if a state hearing is postponed. I got to think about this one, actually.
I got my answer. Don't think too hard.
Don't think too hard.
Nope.
All right. I've got mine.
Stumped on this one.
I've got mine.
You have a,
Okay.
you ready? You ready? I mean, 50-50 shot,
This one's
right?
like a 50-50
Even if you don't
shot.
know.
Yeah.
Even if you don't know.
Okay,
all right.
ready?
3, 2, 1.
Ooh. Okay. Well, there's a difference here.
Yes, there is.
I'm going to explain my thought because I feel like there is some possibility that there is a situation, there's something in the regulation that would say that
Mhm.
if it's the claimant's fault, something rather, that they have the case is postponed for this reason or that reason, that maybe the judge, has the right to discontinue it. But I don't think I've ever seen it.
Yeah.
So
In my time, I don't think I've ever seen aid paid pending for anything. If you ask for postponement and they deny it, they just deny it. They don't say, well, yes, you can have it, but we're not going to give you aid paid pending. But I could be wrong. I really am not 100% sure on this one.
Mhm.
So yeah, I said no because of what you were elaborating on right there.
Mhm.
So we did go over this a while ago. There is something in the regulations that specifies that it is subject to state hearings to determine if aid paid pending should continue, right?
Mm.
And so if a case is being prolonged, like you mentioned with postponements, the state does have the right to reject continued aid paid pending if it's taking too long. So that's why they typically will just not grant postponements
Mhm.
For no good reasons, right? So you have to have good cause to get a postponement to get your hearing continued, right?
Yeah.
But if it's been, I mean, funny nowadays, having appeal go for 6 months isn't so crazy, right?
Oh,
but
no.
just a couple of years, just last year, or like let's just say 2 years ago, if you had 2, 3, maybe even 4 postponements, and your appeal has been open for 6, 7, 8 months, and you haven't had a hearing yet, that was crazy.
Okay.
And so a lot of times not a lot of times, but occasionally they will terminate aid paid pending if they feel that the recipient or the claimant is purposely prolonging it, knowing that the result of the outcome will not end in their favor.
Mm.
So that is when they have the right to refuse continued aid paid
So
pending.
it's kind of like one of those yes/no ones.
Yes. Now I spoke
Yes
very
in this,
confidently
no
on
in
this. And I still haven't gotten
I haven't seen it
So
yet.
that is my answer. Could be right, could be wrong. I don't know.
I really think you might be right. I think it's just something that they basically never do. I think it's something that they probably reserve the right to do that, and they just never actually follow through.
I have heard about it. I think once, maybe twice, but so I have heard it. But
So I think you might have been right about this one. Teresa, why don't you give us the answer?
No.
I mean, I think she was just guessing. Answer is false. I
Yes!
think you were right. I think you were just straight up right about them having that ability.
That's right.
I'm giving you a point. I don't think.
Trick question.
I mean, I did bring up that it could be like that, but I really wasn't sure, so I'm not giving.
Yeah.
Oh, here's an explanation.
That was a 50-50.
It stops if there's no good reason for the delay, if the issue is about law or policy, or after the first postponement in some programs. Well, in this case, we're talking about IHSS, so it would be the first two things.
Yeah.
And like we said, in practice, and this is like what Myra was saying, that the law versus the practice can be different.
Yeah.
In practice, if you don't have a good reason for the postponement, they would usually just say, no, we're not going to postpone your hearing. And if you can't show up, we're just going to, dismiss your case.
Yeah.
So they'll just dismiss your hearing rather than postpone it and discontinue the aid paid pending. And you know why? Because they're overloaded with hearings.
Yeah.
If this was 15 years ago and they had plenty of time on their hands, they might do this where they're like, okay, fine, you can have your hearing, but we're not going to keep paying you.
Mhm.
But
Yeah.
nowadays they're like, we can't deal with this. Get out of here. We don't have time for your hearing.
especially if hearings right now are taking 3, 4, 5 months to get on the calendar,
Yeah.
and then you request a postponement.
Yeah.
Yeah. Anyways,
That can be a problem.
All right.
good job, guys.
I still haven't seen any answers from the people in the comment section.
Nope, you guys are quiet today, but that's all right. We'll do all
You
the
guys
work.
all just don't
It's
answer, and at
Friday,
the
it's not
end you're
Monday.
like, "Oh yeah, I got 10 out of 10, perfect score." It's like,
Mhm,
Are you sure?
mhm.
I keep looking over there instead of over the camera. I'm sorry. All right, Teresa, give us another one. All right.
All right.
All right.
AI sources, are they reliable when looking for information regarding IHSS?
We've had people who have,
Yeah.
been looking for information from AI and getting some insight into how IHSS works or other programs like that. We've had that happen.
We have. Let's not give away too many of our thoughts so far.
Let's
right?
not. Yeah.
Are we ready to answer this question?
Yep.
Okay,
I
the
got to figure out
question-
which side's which.
So much like the regulations of IHSS, the words in this question are very important. So Kelly is saying yes,
All right, Kelly, say
right? So again, the words in this question are very important. It says AI sources are reliable when looking for information.
I think you're kind
regarding
of giving
IHSS,
it away
okay?
now.
Are we ready to answer?
I'm ready.
3, 2, 1.
Yeah.
All right. So we've got 2 answers in the comment section.
That's true.
Do we want to highlight those, Cody? Dakota?
See, at first I thought it said Katarina, but I think that says Kathina. So Kelly said yes. Kathina said general info, yes, but always best to call your local IHSS, which is pretty good advice.
Fair.
Yeah.
Now I'll explain myself. And it's that, I mean, other than maybe some specific instances I've actually seen, in my opinion, AI, the more niche a subject and the more opinion-based a subject is, the more likely it is to give you some very wild information. And it tends to sound authoritative whether something is an opinion or not, right? And it will always give you an answer even if it can't find an answer. And so these are a few of the things that concern me about AI when it comes to like using it for, getting information and stuff like this, that for something that's really obvious that everyone that a lot of people know the answer to, and people have posted the answer online many times, yes, it'll give you the right answer. It's pretty good. And you can look up the sources it has. But for other things, sometimes if you ask it a more polarizing question or a more opinionated question or something that just not a lot of people have talked about online is its only source. If not a lot of people have talked about it, it could give you a really confident sounding answer that is based on absolutely nothing.
If it's a very specific question, like if I have this, da, 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 da,
See,
it could give you something
Rebecca
that's
said
relevant.
yes, but how specific the question is and the reliability of the AI program. Yeah, some
True.
definitely more reliable than others. What do you guys think?
Yeah, I mean, do we want to talk briefly about some of the questions?
I think after we see the answer, you can talk about that.
Okay. Yes. So I agree with everything Dakota said. The reason I said no is for all the same things Rebecca has mentioned, Dakota's mentioned. I think that the more niche, right, the less likely you're going to have it being a reliable source of information. The issue too with IHSS or with AI and in regards to these programs, there's all kinds of different programs out there when it comes to social services. And so every state has their own programs. And some of them they might even call a program IHSS and it's not California IHSS, right? So it's going to be helpful, maybe breaking down regulations, I think, or breaking
terms.
terms.
Like
I
that.
think that could be really helpful. But I've had people that I've spoken with who told me that they use ChatGPT as their advocate through an entire process, like through an appeal process, and naturally did not get a decision in their favor, right? And so I think I mentioned earlier, or I've mentioned before that just reiterating, I think it's a great tool. I think it's a great tool to learn a little bit more, but I do think it would require maybe some double checking. But I'm curious to see the real answer here, the true answer.
Billy, did you have anything to add about just in general
Well, just like the same things, like terms, things like that might be, like, oh, well, what is this in IHSS? Or, I even did that when I first started. I was like, didn't really know what some of the terms were, what some of the abbreviations were. I would look them up. And then I would go back to our references to make sure that they were correct. So I was getting the proper information. But like you said, the person used it as their full advocate and they got denied because it probably wasn't giving them factual information. And it was making them sound smart, but it wasn't what they needed. They needed an actual advocate.
Mm-hmm. Of course, a lot of people get denied anyway.
Yeah.
What I will say,
Mhm.
that AI has got it. They've got it down. I had an appointment with someone this last week where they discovered who Galt Advocacy was because AI referred them to Galt Advocacy. That sounds pretty reliable.
Yay.
Yes. I think I might change my answer, guys. Just kidding.
All right, Teresa.
Kelly?
What?
We've got some answers in the comments,
Oh,
guys.
yeah, we read those ones already.
Oh, all of them?
Yeah.
Oh, okay, perfect.
All right, Teresa, we're ready.
Yeah, what is it?
Okay,
False.
that's what we said, right?
Yes, we also
Now-
false.
Obviously, AI didn't give us this answer, but but the reason. No, actually, when you ask the AI, they're like, "Oh no, we are the best one, and we give only correct information."
Mhm.
But okay, the reason, if the answer is legal or debatable, AI cannot reason the true answer. If AI references from information that is incorrect, it will be correct. And I've seen that. This is actually kind of unrelated to IHSS, but last year when we were talking about the budget issues, I had used an AI source to, or I Googled it, and the first thing that comes up is the AI summary.
Mhm.
And I looked up something about regional center, where their funding comes from, whether it was state or federal, something like that. And I looked it up, and the first thing the AI told me was, "Oh, regional centers' yearly funding from the state is relative, or from the federal government," and it said, "Oh, it's $2 billion or something like that." I'm like, "Oh wow, that's really high. That's quite a lot." And so we were talking about, things going to get cut, there'd be budget changes, whatever. And then I looked at the source, and it was just some random blog pamphlet from a completely random source. And then I looked up the actual budget and how much money was coming from it, and it was like
Significant.
$10 million, which was like 1,000 times less than what they had told me. And I'm like, okay, well, this is a perfect example of like, just because the summary found a source and pulled from it and shared this information, it could be completely wrong, and it doesn't really have a good way of determining what's a reliable source and what isn't.
Yeah.
Mhm.
So we got all that right.
Great job.
So do you want to tell about the problems we had getting questions for this thing?
Sure. Well, Teresa helped put some of these questions together and used AI to help cross-reference some things, and ended up going through 3 different programs cross-referencing each other, and they couldn't get any of it right.
Mhm.
So just some of these questions today, right? And so I think
it just proves our false.
yeah.
The stories I heard was that we had one AI that came up with a whole bunch of questions and then gave answers and gave the source for those answers, and the sources were completely unrelated to the questions or the answers. Another one gave a whole bunch of answers supposedly about IHSS, but were about completely different aspects of law, and we're asking about taxes and immigration that had absolutely nothing to do with IHSS, but said it was an IHSS question and was citing IHSS documentation as the authoritative source for the answer. So there were a lot of issues, and that's why sometimes just the human element of an advocate reading the regulations and actually interpreting them intelligently is sometimes necessary for these more complicated matters. All right, we've got our next question up there. Telehealth video reassessments for IHSS are allowed. Ooh.
I'm ready.
I'm ready as well.
This is kind of a trick question.
It's kind of, I think it probably is. I got to think a little bit more.
I feel like we might have mixed answers.
We might.
because this
So
is
is this like when the social worker comes?
yes. So the assessment, or it says video reassessments for IHSS are
Telehealth.
allowed.
Yeah.
So telehealth video. So we do have an answer in the
Please
comments.
there's
Somebody.
no.
So it says telehealth video reassessments for IHSS are allowed. So yes, annual assessments when you already have IHSS, the social
Mhm.
worker comes to your home once a year. Are they allowed to do it via video call, or do they have to be in person, or do they have to be by phone? That's kind of the question.
The social worker.
Correct.
Mm.
Okay, I've got my answer.
I got mine as well.
I've landed on my answer.
Okay.
I think I'm ready. Okay.
Okay.
Kathina says no. We're going to say our answers, and you guys can let us know what you think. All right, you ready?
Yep.
3, 2, 1, go. Oh.
So I have again, this is kind of a trick question.
It is.
So we've got a couple of no's in the
A
comments
couple of
section.
no's.
So again, I might be overanalyzing. I'll go
I
first.
could be too.
I'll go
Okay.
first. Oh wait, you said no too?
Yeah, I said no too.
Bailey, why don't
Okay.
you
Okay.
go first and explain what you were thinking? Because
So-
you haven't done a whole lot of reassessments yet.
No, I've only listened in on some of them. The reason why I would say that is because there's certain things that they have to do in the reassessment when they go out.
Mhm.
They have to look in specific places. They have to do that, and you're not going to necessarily have someone walk around and show you those things because they want to make sure that the things that are on their reassessment are going to match up with like
Mhm.
they want to know like where the bathroom area is. They want to know where the child's bedroom is or whoever's that they're doing the reassessment for. And they need to be able to see those things in person rather than be on a video telehealth.
Mhm.
Yeah, and I'll jump into my elaboration here. So
Yeah, what do you think?
So right in line with what she's saying. So the question is it allowed? Have we heard of video reassessments? Absolutely. That's all they did during COVID was video and phone call.
Yeah,
right?
yeah.
I still hear people of occasionally getting a phone call or a video. It's a lot less often nowadays.
Mhm.
I have had people still though say that it is an option that occurs. However, to my understanding, assessments, again, I think there's a regulation that says it must be conducted in person. I don't know if I'm right or wrong there.
I'm really not
like
sure.
I
Let me.
saw something.
I'm the odd one out here because I'm the only one that said yes.
Because
And-
technically, I don't think it's technically allowed or supposed to, but it will be done.
I'm not sure. So I have two thoughts.
It's much like I think Rebecca's comment
I went to
earlier.
In
the
circumstance.
I went to the wrong.
Right. Well, Rebecca
Camp
said
angle
something
again.
like yes, but they don't always do it that way. That's kind of my answer.
Mm-hmm.
Technically, it's a no,
Yeah.
but they do allow it. You know what I mean?
Mhm.
That's my answer. Sorry, go ahead.
So I'm the odd one out. I said yes, and there's sort of two things that I was thinking of. One was that they definitely used to do video reassessments, and that was during the COVID time where you couldn't be in person, and so the majority of assessments were done over video then. And for several years after, they were continuing to be done, and even recently, probably like as recently as middle of last year, I definitely heard of reassessments being done. However, the other possibility I think it might be a yes is that I know that when there is a change of need and you request a reassessment for a
Mhm.
change of need, when it's not the yearly reassessment, they don't necessarily have to come out
That's true.
to assess everything and to see the home. They could do what's like a paper reassessment. They say they hear what you say to them over the phone, hear what the change is, and change your hours and send out a notice of action. That is often done over the phone, and I don't know if that's in the law or not. So I'm going to rely on that and
So
see
either way.
what the answer is. But
I have one more thing to add, actually, because that's a very good
let
point,
me see
Dakota.
what other people are saying. Yeah.
Oh yeah, let's see.
So said no. Rebecca said no in person, preferable. I would think.
Yeah.
Lisa put a question. We can maybe check that out in a minute. He said I think no. They paused a lot when COVID because of it, and that was
So-
clarification of the question.
So something that happens in the appeals world is a conditional draw to reassess. That's
Mhm.
when the county agrees that maybe they missed something, they're willing to do another reassessment instead of having to go in front of a judge, right? A lot of times that conditional draw will say, we agree to withdraw from this appeal to conduct a reevaluation or a reassessment.
Yeah.
it doesn't always specify that that means going to your house to conduct a meeting.
Mhm.
Sometimes a
True.
reassessment is just rereading the documentation
Mhm.
and thinking about it some more.
Yeah.
They can consider that a reassessment. So I'm really curious to see what the final answer is
Yeah.
because I
think Joanne said they can be per, is it say ALL?
I think ACL is what she means.
ACL 2472. We should
I don't know
that
one.
might actually be the answer Teresa had.
It could be.
All right, Teresa, you ready? Give us the right answer. Answer. Wait, which one was true? Was true?
We need yes or no, Teresa.
Wait, I forgot what the question was. Was the
Can
question
they do?
they
Can they can? Are they allowed?
Oh, they're allowed. Okay, so I was right. I was right.
I think
They're
yes.
allowed.
You were the only one that said yes.
Yeah.
Okay, explanation gives more flexibility while still meeting the rules. Reference ACL 2472. I mean, whoever.
Yet you suggest
Joanne, you had it exactly correct.
Yeah.
Just big one. Give yourself a 1.5 for that one. All right.
Yet if you suggest it to a social worker, they will flip out 90% of the time. How dare you even consider the idea of a video
So
assessment?
true. So true. All right. Well, I mean, I feel like you guys both, had the that it does happen and it did happen during COVID. I think you guys can get half a point for that. But I'm giving myself a full point because I said yes.
All right, fair enough.
All right. And that one was kind of, I feel like that's probably surprising to a lot of people that it's actually in the law that that's allowed.
Yeah.
For one, because a lot of people don't get them. And for another,
Mhm.
because you would think, exactly like you said, Bailey,
Yeah,
that
there's certain things that they need to be able to physically see.
they're supposed to see the
Yeah.
recipient.
Mhm.
Now, an important part about this is that it specified reassessments.
Yes.
They would not be allowed to do this for a first-time
No,
assessment.
absolutely not.
Because like they have to see the recipient, they have to talk to the recipient, they have to see the
Yeah.
living conditions. Is there any
And
safety
like you said,
concerns?
reassessment could just be going through paperwork, and I don't think I thought about that either.
It could be. I think this does apply to yearlies as well, but
Mhm.
it's more likely they would do it for
Or if there is
a
a change in
for a change
condition,
in need
yeah,
than
we-
for
yeah.
a yearly reassessment.
Mhm.
Yep.
All right. Actually, do we want to go and check with the? There was a question from a commenter. Let's put that up there. Alyssa says, "My 3-year-old has a regional center diagnosis. However, the preschool will not acknowledge that he has a disability that is impacting his education, even though he is not speaking clearly and they sent him home daily for behavioral outbursts, but will not document the behavior as an impact to his education and will not offer an IEP. Is this a school or a Kern Regional Center issue?"
It's a school district
It's a
issue.
School district issue.
We're not going to do the yes or no's on this one. I think this is just something that we want
You
to address.
This is the school district not doing what they need to do.
Mhm.
So if they are not assisting you and pointing you in the right direction, like acknowledging a diagnosis from the experts at regional center or a doctor,
Mhm.
then that's on them. And you probably would, we would recommend probably consulting with an education advocate or an education lawyer to probably assist you with that.
Mhm.
So give our office a call. We'd be happy to help you as if we can. We do have an education team here who can support you on this and at the very least give you some information that might be helpful.
All right. Let's
All right, next question.
just see if there's anything. Okay, yeah, I think we're ready for the next one.
All
All right, Bailey, what's this one?
It's not there. Where is it?
Sorry, there it is.
Is that it? The county must give the claimant its position statement at least 5 working days before a state hearing.
All right.
The county must give the claimant its position statement at least 5 working days before a state hearing. I think I have my answer.
Not including holidays. I've got mine.
So for those who are unaware, while everybody's thinking,
Oh yeah, we should
The-
maybe we should explain what a statement of position is.
yes.
Yeah.
So the statement of position, the SOP. It's funny it says position statement.
It does, but
So statement of
officially it's statement of position.
Yeah.
yes.
So the statement of position is the written report that the county creates, which is kind of like their written argument that they're presenting to a judge.
Mhm.
And
for
it,
the hearing.
and it has to be sent to you for review prior to ever meeting with the judge.
Mhm.
So if you've been through the hearing process before, you've received a big old packet in the mail
Mhm.
prior to your hearing. You're supposed to,
And
right?
it's supposed to include their arguments, all of their evidence, their case notes, the assessment notes, all of that stuff is supposed to be included in their statement of position so that you can review it and make an argument in rebuttal for the hearing.
Yes, and I think I have my answer.
All right, let's see
Are we
if
ready?
anyone said anything. Kathina says
Yes.
yes.
And it was at least 5 days. Is that what it said?
5
Let's
days.
see, it said, yeah, county must give the claimant its statement of position at least 5 working days before the state hearing.
Okay.
All right.
Are we ready?
I'm ready.
3.
2, 1.
I said
Oh,
yeah.
we're all in agreement. What?
No, I said yeah. No.
We all said no.
Okay, we all said no.
You said no.
We
right.
all said no. And I can answer this one pretty easily. The answer is it's not 5, it's 2.
Yep.
That's it.
Yep.
I only
Did
know
you
that,
know that?
because I was in a hearing with my like yesterday, I think it was.
Hmm.
And she was like, well, they thought that they had more days, but they only have this many.
Yeah,
So there it is.
And I'll say, as someone who does a lot of our hearing stuff, 2 days is not enough.
No.
Like when you receive the county's statement of position,
It can
And
be
you have to read
pages and pages.
and this could be the
pages.
first time you're even finding out why they denied.
Mhm.
It shouldn't be. You're supposed to have conversations with them beforehand, but things happen.
Mhm.
This is, you're finding out why they denied. You're finding out what documents they had and what they're relying on. And they're going to bring up, oh, well, in the IEP it says this, and you're like, I didn't even see that in the IEP. What do you mean that you're basing it off of that? That is nothing. You know, all kinds of stuff like this. They'll put forward these arguments, put forward their evidence. You'll see their notes, and you're like, that was never said. Crazy stuff. And you've got 2 days to read it all. It's sometimes it's
Talk
like
to the client
sometimes it's like 100
sometimes.
pages to get through.
Yeah.
Figure out what they're saying, look through your evidence, talk to the
Mhm.
client,
Write
write
a
up a
rebuttal.
rebuttal and submit it, and give them time to see your rebuttal and maybe reconsider. It's
While you're also already juggling. other
it's so little
clients.
time. I wish we had 5 days.
5
And
days would be
Teresa,
great.
she knows we already know.
Did you have you ever had to cancel hearings because when you got that, it gave you information that you had needed to make the hearing?
Yes. So what Teresa asked was, have we ever had to cancel hearings because we get a statement position, it completely throws our whole case out the window?
Yeah.
Yes, we've had that. We've
Mhm.
more often than we wouldn't cancel a hearing. More often it's we get this new information, we have to completely rewrite our argument, and so we'll request a postponement, and we'll say, look, this statement position shows us entirely new information that we had no idea about before.
Yeah.
We need time to prepare new arguments and to get new evidence to talk about this and to deal with this. And so
The county will do the same thing.
yeah.
If
So
they receive a statement,
it's more likely, I would say it's more likely that we would postpone the hearing because we received it 2 days. But there have been times where we see something, it's like we did not know that they received this kind of letter from the doctor or whatever. This completely ruins our case. We need to set this aside and try again at the next year.
Mhm.
Or what'd you want to say?
I was just saying it's vice versa. So it's the same thing with the county, right? When the county's building an argument, but maybe they haven't seen all the information that you're going to include in your statement of position until 2 days before.
Mhm.
And it could be the same thing. You could have just given them everything they need to,
Mhm.
rule in favor of what you're fighting for, right? So,
Yeah, absolutely.
Kathina,
Kathina said something very, very true. It's horrible timing. Sometimes they don't even open the mail in 2 days.
very good.
Very
point.
true. And let me tell you, let me give you 2
Very
pieces of
inconvenient.
advice if you're going to go to hearing. Let me just say this so you hear it loud and clear. One, if you are going forward to a hearing, I recommend that you get a temporary account and log in to ACMS because that's where all the documents get uploaded. So yes, they're supposed to mail you their statement of position. They're supposed to mail you everything else. But it first is going to be uploaded online on ACMS, which I don't remember what it stands for. And that's where you'll see, all the information about who the judge is, the phone number for the person you're supposed to talk to at the county, the date and time when it gets scheduled, that goes up on there. Rather than having to wait for the mail, because the mail can sometimes be unreliable or slow, it's good to get online and check that way. But the second and more important piece of evidence, I don't recommend you ever do your hearings by yourself because the hearing world is a whole nother beast from just regular IHSS stuff, that it's good to have someone who's a professional who already is on ACMS and can check all this stuff and can help you get postponements and things like that already. So,
Agreed.
Yeah.
All right, let me give us all a point before I forget. And we've got 20 minutes. So
Probably a little bit less than that.
Right.
Because we got to give.
are we at the same score? Did I accidentally? I don't know. I hope I got it right. Somebody check my work.
We'll have to go back.
I think that's right.
I think
I
that's
think
right.
we might be tied now.
I guess we are. All right.
Because then you got one wrong, you
Oh.
got one right, and I got the same one wrong.
That's right. That's right. Okay. All right. The next question. IHSS services can be approved without healthcare certification if the person is at risk of going into a facility. I'm pretty sure I know the answer to this one.
Mm-hmm.
I think so too.
How do you feel?
Good.
You got the answer?
Yeah.
All right. This one's pretty quick for us, but let us know what you guys think. All right. 3, 2, 1. Answer. Okay. Yeah, I mean, I think this is a caveat that's written in there. It says if a person is at risk of going to a facility, or I think maybe there's also one that says like if they're at risk of dying within 12 months.
Yeah.
But I think
I
it also
reading it
I think
in
it
the
follows
mounds
up.
of books that
and
I
it
had to
says
read when I
something-
first started.
I think it follows up and it says something like once the services are approved, it then has to be provided within 6 months or sometime. Like it's a longer period. Eventually you have to provide it, but it's in there. So we're all in agreement. We all think we heard the same thing. Let's see if we're right.
Come on,
Andrew.
Teresa.
What is that? What is that supposed to mean? All right, explanation. Let's see the explanation. Certification is required before approval. Temporarily approval is allowed for urgent cases. It must be received on time or within extensions. Okay, I'm pretty sure we all got that right.
Yeah.
That you can get temporary approval without the certification. You just have to provide it later. I'm going to say we all got that right.
Okay.
And I guess there's a technicality that technically you're not approved.
Yeah.
You're not permanent. Okay. You can't be permanently approved without it. That's what we can say about it. But we're all getting a full point for that.
Good job, guys.
Way to go.
No team.
We're not a team. We're against each other.
You still my team.
You guys are going down.
Oh, dang.
I mean, so far we're
hanging in
doing
there.
pretty
You're
good.
doing good.
Yeah.
All right. What time did you say we have to wrap up? When is our
I think
deadline?
we give about 5 minutes for Nicole
Okay.
to jump in here, right?
All right. That gives us
So about 10 more minutes.
all right. We got 10 more minutes to get through as many questions as we can. We didn't exactly plan an exact number of questions. We're just
Just
I
going
just
with the
realized
flow.
is our scoreboard going just right off the side of the camera? Let me just shrink
Yeah,
that
Teresa,
down.
can you see it pretty
Let me just
clearly?
shrink that down a
Just
little
can't
bit.
see Dakota's 5 if he
Okay.
I did have a
You
5.
should be good now, yeah?
I actually didn't have a 5. I just added points for myself just now.
There you go.
All right, give us another question.
doesn't. You're
Give us- All right. There you go.
Domestic services hours are split or prorated only for shared household areas. A person's private room or bathroom gets full hours separately. Interesting. It's a very
Mm.
interesting question.
Oh, that's a tricky one.
So while we're thinking, the quick clarity. So domestic services hours, those are going to be highlighted on your notice of action. So if you have IHSS and you're unsure of what those categories are, you can look at the top of your notice and it'll tell you what those categories are. Proration is, that is when a need is met in common.
Mhm. For example, like now this is not one of the domestic services, but meal preparation. If there are 4 or 5 people living in the home and only one of them is receiving IHSS, even if they need total assistance in getting their meal prepared, if one person is making a meal for 5 people, then instead of getting the full 7 hours, you might get an hour and a half or 2 or something along those lines, where it's divided up by the number of people who are going to be
Or if you have
sharing
to
the
prepare
meal.
the meal separately.
Yeah, that's the other case,
Yeah.
is that if you have to prepare the meal separately, then that if that person's meal is one meal and then everyone else eats something else, then you'll still get the full hours. It won't be prorated. So in this case, the question is domestic services, which is usually housekeeping, cleaning, clearing the yard, snow shoveling, which isn't really much of a thing in California, but those kind of services are prorated for shared household areas and not prorated for the places that the person uses, like their bedroom.
Mhm.
Are we
All
ready?
right.
Yeah.
I'm ready.
3, 2, 1.
Okay, we were all in agreement on that one.
Mhm.
Now, what did anyone else say? Did anyone else answer that one? Oh no, Teresa just gave us the answer right now.
Oh, sorry, guys.
That's all right.
It's all right. We did answer without see. We didn't cheat. We didn't
He said
cheat.
3, 2, 1. I thought he was talking to me.
Okay. Fair. All right. Yeah, we were right. The answer is true. I was pretty sure I had heard that somewhere.
I literally just read it like
Oh, did
3
you really?
days ago.
All
Yeah.
right.
And I feel like you'll sometimes hear social workers say that.
Yeah.
They'll say, "Oh, what areas do they use? Do they use this bathroom by themselves, or does other people use that bathroom?" They'll ask questions
Mhm.
like that. It's for this reason.
Yeah.
If at your assessment you haven't heard these questions asked, it's probably because your recipient is a child, because domestic services as a whole is only assessed once the recipient turns 18.
Yep.
So a lot of people may have never even heard these questions or heard this topic, this category discussed. So,
And then there's an explanation.
Proration applies only to shared spaces from ACIN 8217 and related.
All right.
All right.
Good job,
I
team.
like that ACIN. We should share it with people. It's very good.
Yeah. Give us a point.
Oh yes. I think Kathy said something. You can talk about that. Well.
Overtime pay is taxable for live-in provider with the new big bill.
Mhm.
Was that a question or an answer?
I think it's a statement.
It's a question. Is it? She said.
Oh, overtime pay, is it taxable?
Is it okay? Oh, okay.
To my understanding, there's no new bill coming through for this, is there?
Well, I mean, there was the bill that was passed last year that's being like enacted
Yeah.
for a lot of.
Oh yeah. So,
But I don't think that changes the
No.
taxability of provider wages
No.
if they are a live-in provider.
Yeah.
I think your wages are all untaxable regardless of whether you're getting overtime or not.
yeah, the only issue was capping the overtime hours. It had nothing to do with taxing.
Right. That was
Yeah.
the state thing. They wanted to cap overtime for providers to a certain point and not let you claim more than that.
Yeah.
Yeah, I don't think there's a change in taxability, but I could be wrong about that.
To our understanding, the answer would be no.
All right. We've got another question for Stump the Advocate. Social workers can choose to use the old time per task method instead of functional index rankings for assessments. I guess like we've been giving context. Let's give context again for what this means. So, and the ACIN that she listed before actually has a great write-up on functional index rankings. Functional index rankings is essentially the way that the county currently uses to determine how many hours a person needs, where they'll use a ranking system from 1 to 5. Rank 1 means a person is totally independent in a task. They are completely able to do it without any help at all. They don't need any time in that task. Rank 5 is they cannot help at all. They cannot make their meal at all. They are completely unable to clean for themselves, whatever, any other thing. And then the ones in between, rank 2 is they only need verbal instruction, prompting, reminding, that kind of thing, but they can physically do it all themselves. Rank 3 is they need a little bit of physical help, and rank 4 is they need a lot of physical help. And so when a social worker is assessing you, they will say, they'll ask questions and get, okay, so they can do it, but they need, a little bit of help. That sounds like a rank 3.
Mhm.
They'll put down rank 3, and then they have a chart that says rank 3 gets 3 hours and 20 minutes. And so they say, all right, 3 hours, 20 minutes. Time per task is the way they used to do it years ago,
Mhm.
where they would actually go each individual category. They'd say, well, how long does it take you to do this? Oh, it takes an hour every day. All right, hour every day, 7 days a week, you get 7 hours. And they would do that for every single category. So with all that context out of the way,
Mhm.
social workers can choose to use time per task instead of the functional index rankings for assessments.
Are we ready to give our answers?
Sure.
All right. Yes, I guess I'm ready.
Okay.
I think I know.
Yeah.
3, 2, 1.
Okay, there's a little bit of disagreement. Bailey, you're the odd one out.
Okay, I'm the odd one
Oh,
The only reason why I say this is because I was in a hearing yesterday with Mitchell, and the judge really focused on the time versus the actual number ability. And I mean, that could go really either way. So he was very focused on like, okay, well, how much time does it take you to, get his medicine together? And do you have to administer it for him, or will he do it on his own? It was kind of that kind of thing.
So
I'll just say I'm not very confident in my answer.
I'm a little shaky too. I feel that the old method kind of gives us the answer. The fact that it's old, the whole reason we have the functional index ranking is that it's how they assess. But I will say, so I like to break down the categories into 4 sections, and hopefully this helps clear things up. You have domestic related services for section number 1. That is ranked and tiered. That's how they determine the time. The rank tells you how much time you're getting. The second section is going to be personal care services, ADLs, activities of daily living. That is the bathing, the texting, the toileting, bowel and bladder care, all that jazz, which is also ranked and tiered. The third section is going to be paramedical or tasks that are medical in nature. This is not ranked or tiered. This is the time method because they have to calculate how much time it takes per task. So if you get the doctor to write out a paramedical form stating that it takes you 5 minutes a day to check your, prick your finger and blood pressure or blood sugar levels, and you do that 3 times a day, that's 15 minutes for that task per day, right? That's the time method in a sense. And then the fourth and final section is protective supervision, which is not the time method or a ranked task. It's a fixed amount, 195. So to go back to that, I love your answer because it does help answer that. But it may have been just focused on the paramedical side of things. Do you remember them talking at all about the actual tasks?
Well, there was one that they were talking about, and it was cleaning the oxygen that he had to sleep with at night, preparing the medication because he couldn't do it on his own, and then actually physically having to make him take his medication.
That does sound pretty paramedic.
It does.
So I'm really
yeah. So
okay. Well, I'm curious because I think we're all a little shaky.
I'll say I'm a little unsure about my answer. I did say no, in that they
I'm only
can't
going
use
by
the
what
time
my
to task.
experience has been in the
However,
in the hearings that I've been in.
Like I said no, that they can't use time per task instead. However, I do know that there are exceptions to the functional index rankings, right?
True.
Where it's like even if the functional index ranking says 3 hours, if there are extenuating circumstances and the person has a more severe case or needs help more often or something like that, they can do exceptions and go above or below a high or a low rank or add more time.
That's a good point.
But the reason I still said no is that I don't know if that would still be considered using the old method,
True.
or if that's just an exception to the functional index rankings that is still part of the. So I could really go either way, but I'm sticking with my no answer. But let's see.
I'll stick with no as well.
Let's see the actual answer.
Are we going to get a yes or no from Teresa, or true and a
Here
false?
comes
False.
Okay, that's what we said. We said they must not use time per task and use hourly task guidelines functional index instead from that right. And to what we said, there is exceptions. They can go up to the high, even the functional index ranking isn't just one number. There's a high, a medium, and a low. And they can go to the highs and the lows. And I think they can even go beyond the highs and lows to some extent.
I have seen in some cases they'll go past the high, or the maximum in a sense, but
it's not, they're not asking the person, well, how long does it take you to do this thing? And basing it on that, it would be, they start at the functional index ranking and then say, are there extenuating circumstances that double or triple the amount of work they're doing? And that's the basis for it, not what the person is actually having to do.
Wonderful job, guys. We're out of time.
Well, I have one last question.
Okay, is it a quick one? Do we have a quick one?
I already posted it. So
Speed round.
All right, we get like 10 seconds to answer this one. All right.
All right.
IHSS personal care services can be provided at a person's job if the hours stay within their total approved home hours. Well,
I don't understand this one.
That you can provide personal care services, which is usually that's like the bathing, bathroom
at a person's job.
At a person's job, if the hours stay within their total approved home hours.
Like they work from home.
I don't understand.
I guess that means if a recipient works part-time, that their provider could go with them. and do some of their personal care tasks.
At whose job? The provider's job or the recipient's job?
I think it's the recipient's job.
Can a recipient have a job and claim IHSS?
Yeah.
They have.
I mean,
I've never heard of that before.
the only requirement for getting IHSS is that you have a disability,
And they have Medi-Cal.
well, and Medi-Cal, and that you are unable to perform some activities of daily living.
Hmm.
A person can have IHSS and still be able to do other things. I mean, a lot of, something.
True.
A kid
True.
with Down syndrome can go and do their
That's
day
true.
program
You're right,
stuff
right.
and their,
Mhm.
work type things, even if it's only 5 hours, 10 hours,
Yeah.
a week. So the question is, can their provider provide IHSS services while they are at their job? All right. We said we would make this one fast. So 10 seconds.
Okay.
Think about it.
I guess I'm ready.
All right. Ready? 3, 2, 1, go. Okay. Again, I'm not sure about this. I'm not going to take a lot of
I
time to
don't know.
explain. We said this would make this quick. I just don't think, I'm pretty sure I've heard that it has to be provided in the person's home
Mhm.
or at a place they're staying if they're like on vacation.
Yes.
It can be provided there, but I don't think you can go.
I've never heard of it being at work.
And most personal care tasks you really couldn't do at work, but I don't know. I don't think that's what IHSS is for, but
you can get paid for personal care tasks at doctor's appointments.
that's true. That's
Yeah.
true. And if they go do the grocery store and do shopping, but
But it says at their job.
you wouldn't do the personal care services at that place, would you?
Not at the job.
Possibly.
Well, yeah, the doctor's
Who
office,
knows?
you might. Ambulation transfer. That's true.
All right.
Ambulation transfer are personal care
Yeah.
services.
Let's
so
let's
True.
see it, Teresa.
Okay,
we
okay.
might have been totally wrong about this.
I said yes.
All right.
Let the record know.
Answer true. Explanation. Let's see what it says. Yes, if the services are the same type allowed at home, help keep the job stay within total hours and do not replace what the employer must do under ADA.
Hmm.
So yeah, I guess that would be things like ambulation transfer, bowel and bladder care, the things that you might have to do during work.
Yes.
Provider can help them do. That's
Now that I think
Let's
that way.
let's give Caleb a point.
let's give Caleb a point. You know what that means?
And we're out of time, guys. No more questions. Sorry.
What do you know? We're out of time right then and there.
Woo!
Man, I should have made a big banner that just
Cool
says
off, cool
Caleb
off.
wins exclamation point and everything because I knew you'd be the best one here.
Yes.
You need one of
You
those
had
little
to be.
marquees. Winner, winner.
Well,
Nice.
that's all the time that we have. We're running a little late, but it happens.
Thanks for joining us,
Thank you
Bailey.
so much,
Yeah,
everyone,
absolutely.
for
Thanks for having
watching,
me.
and thank you, Bailey, for joining us. It was a lot of fun, and it's really enjoyable to just kind of get our different perspectives and share our different thoughts on this. So, I hope you all enjoyed. This was Stump the Advocate. We're going to be back, I think, to our regularly scheduled, just talking about a regular topic next week. But if you enjoyed this, let us know. Leave us a comment, and
Watch
maybe
Nicole.
maybe what?
Watch Nicole.
Oh yeah, watch Nicole. They're going to be doing the same thing in Spanish on our Spanish Facebook page and on YouTube. And yeah, if you like this, let us know. Leave us a comment. Tell us you want us to do this again. And if you didn't like it, tell us.
Keep it to yourself.
Yeah, we enjoy this. We did this for us. No, I'm kidding, but yeah. Thank you for watching, and see you all next time.